All right, guys, it's your turn. So maybe you are that guy when someone says to you, hey, you should try acupuncture. You think to yourself, well, what do I need it for? I don't have any issues. Or maybe you're that guy who does have some issues, maybe some pain, and you think, it'll work itself out. But then days go by, months go by, years go by, and still not resolved. Or maybe you're that quintessential man that I built this podcast for who says, yeah, but I don't like needles. Well, I think you might be surprised as to what is normal and what is actually abnormal in regards to your health. And I'm going to go over 5 main reasons why men do seek out acupuncture. And some of those reasons you might not even realize are an issue, and your body is actually giving you little signals saying that something is wrong. And if we ignore those signals, those things can become major issues and long-term chronic problems. So let's talk about it. I'm Dr. Lone, and this is But I Don't Like Needles. So I want to go right off the bat and start with number 1 reason that men come to acupuncture is for pain. Now, most people do wait until the last minute to try acupuncture. They've already gone to their primary, they've already had cortisone shots, and they just haven't gotten anywhere. It's been chronic, it's been sitting there for a while, and they have tried everything else, and someone suggests acupuncture, and so they finally reluctantly walk in my door. The other option is that perhaps someone in their life, a partner or a brother or sister or someone of that nature, maybe a dear friend, had results. They see that person go in with pain or discomfort or something wrong, and then they come out and they actually can witness the difference and they want a piece of it. So then they come in. However, we need to remember that the longer we go with treating pain, the harder it is to actually resolve the pain. Pain has a way of changing how it circuits through the brain after a few weeks. An acute treatment is right away the best thing you want to do. If you immediately get injured or hurt, the sooner you get treatment, the better, because you can address that issue and it will resolve. If you wait longer, after a few weeks, it circuits through the part of the brain that the amygdala that has an emotional component to the injury. Now there is an emotional component that we also have to address. That emotion might be fear of never getting better. It might be fear of when it feels better that it's going to come back. It could be just any kind of frustration around having that pain for so long or that it happened in the first place. So now we have to address not only the pain, but the emotional component of the pain, even the identification with self with pain. Well, this is just where I am. I'm old now, and this comes with it, right? So we have to change that mentality as well as the actual pain. When people come in for pain, specifically men, they wait until they can't get to work. If they can't work, now they have to do something about it. So that usually entails lower back pain or maybe carpal tunnel, because they cannot function. They cannot sit, they cannot stand, or they cannot type and get the work done. And therefore, this has to be resolved. And again, we tend to have to deal with the chronic instead of the acute. It works really well here. And as acupuncturists, we kind of joke about it. We go, that's the easy part, is the pain. The pain and getting you in alignment, that's the easy part. It's the deeper things that are underlying that sometimes manifest as pain that we have to address. And that goes into some of our other issues that we come in. When people come in with pain, we as acupuncturists, East Asian medicine providers, we don't just treat a branch, we treat the root. As I maybe have mentioned in a previous podcast, you want to have the whole picture. If we put you in alignment as a human being, and that means physically, emotionally, and hormonally, all of those sort of systems in alignment, then you will work at best. Digestion will be better, your sleep will be better, your fertility will be better. So we don't just treat the branch, because if you do, you're going to probably have reoccurrence. So underlying that pain, oftentimes there is either a structural imbalance or even something deeper, systemic imbalance. So number 2 brings me to digestive issues. Many people walk in my door and they come in for pain, and the more we can talk about their review of systems, where I go through all the different organs in their body and all the different functions, head to toe, we start to realize there are more imbalances than we think. Because we go through life, especially in our culture, thinking that it's normal. For example, having bloating after you eat. Not normal. It's telling you that something's not digesting. Something is not processing. Something is maybe even fermenting in your gut. And that is a problem. There is an issue with your biome. There is an imbalance of your pH. There is an emotional constraint issue that causes the fight or flight, feed or breed part to shut down. And then it goes into sympathetic response instead of our parasympathetic response. Those seems like not a big deal, obviously, until you get to a certain situation where now you are dealing with colon cancer, or you are in a place where you cannot go to any place without having diarrhea or digestion issues. So this now disrupts your life. But most people on a regular basis are struggling with an imbalance in their gut, and those little red flags are very important to pay attention to. As we know, the gut is everything. It's where we absorb our food. It's where we absorb our nutrients. Those nutrients serve our cells. If we do not have a good balance in our flora, we will have deficiency, and then our cells are starving, and now we're craving foods and sugars and things that we don't really need or want, and we say, oh, I just have a sweet tooth. Well, maybe you have a metabolic issue and you're not absolutely absorbing the nutrients you need, and your cells are using a quick fix, and glucose is the answer. Instead of getting an apple, we'll go for something really sweet. And that, of course, now, as we know, has a cascade of responses of inflammation, and that's not going to do us well in regards to pain. So the digestive relationship is a big thing to pay attention with men, not only because there is digestive issues with most people in our country, and number 3 is the emotional constraint. So it is a common thread in our society that we need to just sort of push through, muscle through. Don't think about it. Don't mind it. Don't be weak and complain and cry. Just go to do your job. And once you break, then it's worth getting some help. And that can put a lot of pressure and a lot of stress, performance anxiety, and a lot of weight on the shoulders of what we would consider the male or head of a household. And that will be internalized. If we don't express it, if we don't talk about it, if we don't get it moving, it will get caught in our stomach. That's why we say we get a pit in our stomach when we're upset. That's why we have butterflies in our stomach when we get nervous. It all affects our stomach, and that digestive issue gets shut down. And again, we are no longer in parasympathetic feed or breed. We are in fight or flight, and we are in this survival mode that literally shuts down our digestive system, thereby causing some bloating. It can sometimes cause pain. And then we have this backlash of, we can have constipation, and then we have diarrhea, and then we have foul smelling stools, and people think that's normal, and it's not normal. Yes, it does have a correlation to what you're eating, absolutely, but there's more to it than that. It's not only what you're eating. You need to be a little more clear as to what you're eating that might be affecting you specifically. But then there's the emotional component that absolutely has an effect on our metabolism and our digestion. And I'll tell you a story about this one gal. She was a patient of mine, young girl. She was a runner. And she came to me for stomach pain. Her and her mother was there, and we were trying to figure out why she had this severe pain. And they were putting her on pretty intense medications for pain, trying to get this to resolve. The more I talked to her, we talked about the fact that she likes to run, and she also plays lacrosse. What I realized is that she had pain when she ran, but not when she played lacrosse. And the thread that was missing with lacrosse is that when she was running, I asked her, are you solving all the world's problems, or are you rehashing something that happened, or are you planning or thinking about all the things you have to do? And she said, yes. I said, when you're doing lacrosse, that's not happening, right? She said, no. So being in that moment in the game, only thing was being present and getting the ball where it needed to go. That was fine, and that did not cause her any stomach pain. But the running, because her mind was thinking and she was worrying and stressing, caused this pain. We really recognized that from there on. We worked on breathing through the running and using it as a meditation more than a planning of her day. And she started to connect the dots in all of her life, the moments when she starts to have stomach pain, that she wasn't being present and she wasn't breathing and she was worrying and she had to talk to someone. So that was that story that relates to the digestion. And in regards to our red flags, just mind you, our bodies really respond to our external and our internal environments. Another patient of mine, she worked in the prison system and she was working nights. So our bodies are not meant to digest at night. So she had developed colon cancer. And there are histories of this. There's actual documentation about the more that people work in the evenings, and nighttime workers actually have an increase of colon cancer. So these little things that people don't want to look at or don't want to connect the dots, we have to pay attention to. We need to have a regular rhythm. We need to reduce the stress, and we have to be aware of what we're eating, and we have to pay attention to it. We are very disconnected from our bodies because we're in our heads and we're thinking about what we have to do and what we need to do next, and we're not always connected to our bodies. That is another side note, a beautiful thing about this medicine. When people come in and they say that everything is fine, i.e. that first patient I talked about in the intro, I don't have any issues. Oftentimes they think they don't have any issues because they're powering through. But when they actually stop, they lay on my table, I start asking them these questions, they start realizing, oh, I've got more going on than I thought. And then sometimes I'm actually palpating and they'll notice, oh, wow, that hurts. Why does it hurt when you're touching there but not on the other side? And then I get to explain how there are some things that are backed up. When things are backed up, they're painful and you need to move it through. And there's a connection that happens between the head and the body. And the head, what connects the head and the body is the neck. So just on that note, remembering that neck pain is so common because we are not only sitting at our computers all day, but we are also disconnecting our head from our bodies. We're in our heads thinking so much, and we get a lot of things stuck around the neck. And the neck is important. That's where we have huge arterial flow, lymphatic drainage happens here. It's a very delicate place where the cervical spine has the nervous system that come through there. So just understanding that as well. Our third thing that I want to come to is what people don't realize is that we can treat hypertension. We do help hypertension. So hypertension, i.e. blood pressure, again, relates oftentimes to this fight or flight, emotional stress, things being kind of compartmentalized, burying down, not doing exercise, not moving, not expressing feelings, communicating, getting things off their chest. When you think about stress, oftentimes we think the large muscles in our body, but guess what? All the muscles, including the smooth muscle that lines our organ systems within our viscera, as well as the arterial system, all have a smooth lining, as well as the fascia on top of the entire body, which is that layer of muscle on the top of the body. Those layers of muscle tend to be constantly tight and contracted when we are in a more systemic fight or flight response. It's not always from an injury, but it can be when it's all over the body and it's internally occurring. It's happening from a systemic, emotional, stressful scenario or situation. We are going to want to address that by relaxing those muscles, and acupuncture is one of the quickest ways that I know of that can get us kind of trigger flip that little switch to get us out of that fight or flight, to get us to relax. It also increases healthy blood flow. And there are herbs too that are known for reducing blood pressure and will help relax those vessels. Another reason, leading us to our next number 4, reason why men will come to us is also because of cholesterol. So not only is hypertension, blood pressure issues caused by the pattern of stress and tight muscles, etc., but also due to plaquing and to cholesterol, which is fats that have accumulated. And this is directly related to specifically the liver and the kidney function. This needs to be as clean and as on top shape as we possibly can, especially as we go through different times in our life, i.e. puberty or menopause for women. As men get older and our vessels get a little different, we're going to want to pay attention to the foods that we eat, of course, but we also have to make sure our livers are tip-top shape, because the liver is in charge of fats. And fats are cholesterols, fats are hormones, fats are obviously fats, and we need to make sure we're getting good fats, but as well as cleaning out some of and making sure we're reducing some of the trans fats. And we want to keep that moving with acupuncture, which is going to help with that. And then herbs as well. There are specific plants and herbs that have been known to reduce cholesterol, especially for those folks that maybe don't respond to statins. This is going to be a very good option for you. And let me just say right off the bat, if you're coming to me and you have very high blood pressure, I'm not putting you on herbs. I'm going to send you to get medicated. So just disclaimer, hypertension is a silent killer and it is not something to play with. You definitely want to get that under control first and foremost, especially if it is high, not borderline, but high. And then we can, once you are on that medication, we can talk about supplements and herbs and acupuncture to wean you off of it if that is what works for you. Those of you that are borderline and they're not real sure if they want to put you on a medication, then that's prime for us to come in, do our acupuncture and do our herbs and change your diet and focus on things that are going to help you reduce your blood pressure. Finally, the fifth reason that people come to me, and when I have men come to me for this issue, or if they find out I'm doing this, I can treat this issue after coming to me for pain, and we have success, then they end up being my patients for life, basically. They come to me for libido. So libido is the reproductive desire for reproduction. Libido is the desire to reproduce. It is desire for sexual activity. We can help with the desire to do that for stamina. We have herbs that are specifically focused for increasing testosterone. In regards to fertility, you will notice that there will be an increase in your motility. There are specific herbs that have been proven to help with sperm motility, increasing fertility success. So these are all different diagnoses at the bare bones, the most common. These are the diagnoses that are the most common that men will come to me for or eventually get treated for. But that does not exclude many other diagnoses, i.e. insomnia. We will treat that. People will have different autoimmune diseases. When we deal with oncology, obviously, I have treated men who have suffered cancer, different types of cancer. There are men that come for many facets of medicine, but I would say that these are the top 5, and they have been successful, and they return, and after they have success, recognize that this is a good medicine to keep in their lifestyle. So, number 1, pain, of course. Oftentimes lower back pain, carpal tunnel, and neck pain. 2, digestive issues. If you are having bloating and you are having constipation, foul-smelling stools, you are having stomach pain, these are not normal. They are red flags telling you something is not okay, and it will cause large issues later down the road if not dealt with. Number 3, blood pressure, hypertension. This is a silent killer. It needs to be addressed, and you can address it with more than medications. Sometimes medications don't work for you. Sometimes they do. Sometimes you have a lot of side effects with those. We can definitely help you with those, but we can also see if we can as well reduce your blood pressure with herbs and acupuncture for that. 4, cholesterol. Changing your diet, using herbs, talking about blood flow and lymphatic movement is going to help with cholesterol. And that is also going to help reduce hypertension and all sorts of cardiovascular diseases. And then 5, when it comes to your libido, when it comes to reproductive health, it's going to help here. We're going to increase your blood flow. We are going to get you out of that stressful state. These are all important things for you to be the vital man that you can be It doesn't matter whether you are 20, 30, 40, 50, or 60.
The information provided in this podcast is for educational and informational purposes only and is not intended as medical advice. Always consult with a qualified healthcare professional before making any changes to your health, medical treatment, or medication. The views expressed in this podcast are those of the hosts and guests and do not necessarily reflect the official policy or position of any medical institution.